my name is Tara. I'm one of the Cuidiú Antenatal Ireland instructors, and I'm going to talk to you in this video about massage as a comfort measure and pain relief measure for labor. So massage is one of those self-help techniques that it can be used really effectively to ease the sensations of early labor and established labor. It's something that you can use while staying at home as long as possible before going to hospital. Something that you can use at home and in hospital. This is a video definitely to watch with your partner. So if your partner's not with you, do go grab your partner, and so that they can pick up a few techniques to support you in labor. It's also a really good one to practice in pregnancy because it has lots of benefits. Studies have shown that massage in pregnancy helps to promote relaxation and to reduce anxiety and to reduce stress levels. So it's a really good one to practice. So why is massage such an effective comfort measure in labor? This is because when massage and touch are welcome, they help to promote two really important hormones for labor. And these are hormones that Moira discussed in more detail in a previous video, so you might want to go back and have a look at that one as well. So those two hormones are endorphins, which is the body's natural painkillers and mood enhancers. And the other hormone that massage promotes is oxytocin, which is that hormone of calm and connection that causes contractions of the uterus and allows labor to unfold really nicely. So it's no surprise that massage has been linked to shorter labors as well. So touch conveys a message to the person who's being massaged that they are loved and being cared for. But it's really important to acknowledge that not everyone appreciates massage all the way through their labor. So it's really important to tune in and check in with the person that's being massaged and just make sure that it's working for them, or if there are any adjustments that can be made that would help. So for comfort and pain relief during labor, massage can be done on the shoulders, on the head, on the back. It can be done on the hands, on the legs, on the feet. It can tie in really nicely with acupressure points as well. So the person who's giving the massage might like to use a little bit of oil, maybe some almond oil or a light vegetable oil. Essential oils can also be added, but it is really important to check that those oils are safe for use in labor and that they're being used in the right amounts. So checking in with a certified aromatherapist is a good idea. So I am going to demonstrate a few different techniques, 3 different massage techniques that you might like to try. I'm going to go grab my daughter Derva, and she's going to help me demonstrate those. I'll be right back. Hi. So with my assistant Derva, my daughter Derva, hi, I'm going to demonstrate 3 massage techniques that you might find useful for labor. So if you'd like to turn around, I'll demonstrate the first one, which is the cat paw, and that is something that's really nice, especially during the first stage of labor. It's nice and relaxing to keep calm and to conserve energy. So starting with both hands on the shoulders and moving one hand down the side of the back to the side of the spine with a firm, even pressure, and coming off at the hip, putting the hand back up on the shoulder and moving down with the other hand. With a nice even pressure across the hand, again coming off at the hip, hand back up on the shoulder, moving down the other side. How does that feel, Derva? Good. Great. So you can carry on that way, or something that some people like even better is a light touch. So instead of the firm pressure, a light touch down the back to the side of the spine. How does that one feel? Good. Do you have a preference? This one. You like this one? Great. So it can be for different parts of labor that different pressures feel better. Okay, so that's the first one. That's the cat paw. And then another one is just a classic shoulder rub. So that can be just a nice shoulder rub. Relaxing the shoulders is really important for nice rhythmic, even breathing. It sends oxygen to the body for energy and oxygen to the baby. So then you can also just go down the shoulders and down the arms, coming off at the hands. You can do that again with a light touch or a firm pressure. Which one feels better?
Maybe this one.
The firm pressure this time. So always checking in, finding out what's working. So then the third one is a counter pressure on the sacrum. And this can be really nice if the person in labor is feeling a lot of pressure in the lower back. So that is again with the palm of the hand pressing into the sacrum. Is that okay?
Yeah.
Great. So fingers pointing up and palm into the sacrum. And that's a pressure that's held usually for the length of the contraction. So that could be about 30 to 60 seconds, depending on the stage of labor. So between the contractions, it can be really nice to ease the lower back, to do a figure 8 then with the palm of the hand. So crossing at the sacrum, you're going around one hip, crossing at the sacrum, and around the other hip. How's that, Dorothy?
Great.
That one's your favorite, isn't it?
Yeah.
Okay, so those are 3 techniques that you might like to use in labor. I hope they're really helpful to you.